Hello again, I'm Dr. Mark Trolice, the Director of Fertility C.A.R.E. here in Orlando, and we've been chronicling the journey of our medical assistant, Christina Rostad. This is not Christina.
No.
We have a little bit of a lull in Christina's journey, so I thought it would be a good idea that we bring on an expert, a reproductive health attorney. She is Eileen Coe from the Frank Family Law Practice in the Orlando area, and I thought it would be a good idea right now to talk about what are the legal issues involved in surrogacy, and the delay that we're having right now, I think we can safely say it's always the attorney's fault, correct?
Absolutely not.
Okay.
No, sir. The delay here, I think, is due to her having, she needed to be immunized, and we had to make sure that she had the right immunities. But you're right, there are many ways that a surrogacy can be delayed through the legal process. You want to really get started on your contract as soon as your surrogate is cleared. You get by that psychological examination and call the lawyer and start getting it drafted. You should not wait until injectables start, because I think that makes people feel like they have to sign. And of course you don't want that. You don't want any pressure on anybody. And it's a difficult contract. It's many, many pages long to cover every contingency because there's so little case law.
What is the most challenging part for the couple that want to be intended parents through surrogacy? What's the big obstacle in terms of the legal aspect?
I would say number one is insurance. You have to make sure that if your surrogate does have health insurance, that there's no exclusion for surrogacy in that insurance. And we work with people that can take a look at the policy, or even if you need to purchase a policy, that's something that can be dealt with. But that's number one, because you certainly don't want to be paying for the surrogate's entire prenatal care out of your own pocket. So that's number one. I think that number two is the issue of termination. If that's, it's a sticky issue, but it's something I talk about as soon as I pick up the phone with a potential client or surrogate, because what I say is, as long as you're on the same page about that, whether you will or you won't under certain circumstances, both sides of this have to be in agreement, or it can turn into a very, for the intended parents, they feel strapped, they can't make that decision, or the surrogate feels like she's doing something against her will. So it's very important.
A lot of patients worry that when they get into the surrogacy issue, they're not going to get their baby. So why is Florida a good state for surrogacy, and what are the possibilities that the patient, God forbid, never gets their baby? Is that even possible? But let's talk about Florida as well.
Well, I will restrict myself to Florida because I'm not licensed other places, but it is really not possible for a surrogate who is not a genetic mom to have any right whatsoever to keep that child. It's in the statute that she is agreeing that she is not the genetic mother and that she will terminate any parental rights that she may have. And our contracts are also very detailed and very clear who the parents are, that she is the surrogate. We make sure that she's taken care of as a surrogate and advocated for as a surrogate, but she doesn't have a genetic component in this, and therefore she is not a biological parent that can assert that right.
In Florida?
Correct.
Yes.
Yes, sir.
What Eileen was referring to, just as a means of clarifying, two types of surrogacies: traditional surrogacy and IVF surrogacy. Traditional is where the woman who's a surrogate actually ovulates and is inseminated with sperm. She carries the pregnancy. IVF surrogacy is where you have three parties involved: an egg donor, a surrogate, and the intended parent's sperm. Traditional surrogacy, more difficult?
It is more difficult in the sense that mom could come back and say, this is my child. But even under those circumstances, Dr. Trolice, there is a statute in Florida that says that she consents up front. As in our contract, she's consented up front, and she has to actively rescind that consent afterwards. Also, the contracts still deal very clearly with she's entering into it not to be the mom, and that the consequences of that breach would be she would have to reimburse everything financially. That doesn't help the heartbreak, but I think I've never seen it happen. It's not something that has happened in my practice.
So the conclusion, of course, is to get an excellent attorney who's very experienced in reproductive law and surrogacy to really safeguard yourself from the issues that can occur. So until next time, this is Mark Trolice, Director of Fertility Care, and we've had a pleasure speaking with Eileen Coe, a reproductive attorney here in the Orlando area. Take care.
Thank you. It's good talking.